So, for this week's discussion board, we were to reflect on the mission and values of the Catholic ministry and Bon Secours Healthcare and to incorporate them in the patient teaching for the simulation in the mother, excuse me, from last week's simulation. So, the mission for Bon Secours Health Systems is to bring to healthcare, bring compassion to healthcare, and to be good help to those in need, especially those who are poor and dying. Our values are respect, justice, integrity, stewardship, compassion, quality, growth, and innovation. And I feel like, for the most part, as healthcare providers and especially as nurses, we incorporate a lot of these values into our daily care, regardless if we're members of Bon Secours or the Catholic ministry. I mean, nurses are known for compassion, but we also respect our patients and we try to provide them justice by protecting their rights as people. And we also respect their dignity and protect those things. We provide ethical care where, we treat everyone justly and equally, regardless of any affiliations, background, race, culture. And we should all always provide quality care in our services. So I feel like these are things that are just ingrained in us. We don't actually think about it, but we perform them daily, countless amounts of time, and we don't really stop to think about them because our focus is truly always the care that we give our patients. As far as the pain management teaching, I find it a little bit difficult with the situation in this simulation to provide good quality pain management teaching because there are a lot of unknown factors involved with this patient. Because she is homeless, we don't really know if she is an underaged mother or if she is just 18, just a young mother. So there are just some factors out there that I would feel more comfortable if I had that information, but for the most part I would assume that basic postpartum pain management teaching would be involved. I'm not a maternity nurse, so may fumble a few of these things. It's been a long time since I went to nursing school. But first of all, I would assume that as a discharging nurse, the patient would more than likely be getting ibuprofen or Motrin. I would go over the need to take those as scheduled or on an as needed basis. And be sure that she's taking in enough fluid as well as eating to help cut down any stomach irritation that could possibly be involved in that. Not everybody tolerates medications in the same way. And of course, the intake of water is very important just because of the constipation issues. She would have had some more powerful narcotics during her hospital stay that may cause her a little bit of GI issue after she gets home. Definitely there are alternatives to ibuprofen or other prescribed medications. We have relaxation and breathing techniques, repositioning sometimes can help alleviate pain. If the pain is from an incision, I'm assuming she did not have one because the video did not say that, but also some of that information we needed, to do a little bit of splinting with hugging a pillow if she needed to cough or to reposition over that. That could alleviate some of the pain and discomfort. Any episiotomy issues could also be handled with some ice. In that situation, we'd also want to make sure that we give her good instruction on keeping that area clean around the incision or any stitching to alleviate any issues in the future with any type of infection. Along the lines of that pain, back to the pain, assuming she would not be breastfeeding due to her situation, so she could also be in some pain from some engorgement or any stimulation to the breast area. Again, ice could help with the alleviation of that as well. And, she should rest as much as possible, not do any heavy lifting, anything heavier than the baby to try to ease back into her regular activities and wear comfortable clothing, do the best she can to try to eat high fiber and just walk around, because I really think after any type of surgery or medical procedures, that it does help to try to get up and move around to keep you from getting that stiffness in your joints. Also can cut down on any possible DVT issues, but to keep moving, get that good blood flow going. So hopefully she would take those teaching and that advice in mind and carry that forward after her discharge and continue to follow up with a physician or possibly a clinic on an outpatient basis if she had any issues, or even to return back to the ER if she had any fevers or nausea, vomiting, those type of issues. But with the situation that she's in, it's difficult to say, but one would hope that we would provide her with some good resources to help her be successful with her care and with her baby's care upon discharge.